Hello, everybody. Andy Jacob here with the DotCom Magazine Entrepreneur Spotlight Series. I have a great show today. You know, I've been waiting for this show for a number of weeks because everybody is talking about healthcare. I mean, it's so important. And of course, throughout the world, there are certain companies that are really changing the entire dynamic of healthcare, and especially when we think about fintech, financial technology, and how it all incorporates with healthcare, because the two have to go together for our healthcare systems to work right. So we've been able to really bring in one of the worldwide leading experts in the field. His name, of course, is Terence Mills. He's the CEO of a company called Veuu Incorporated, and his company really helps other companies in the healthcare space. And of course, he's an expert on blockchain. He's an expert in, of course, artificial intelligence as well. We're very excited to have Terence on the show. We have so many questions for him. Terence, welcome to the DotCom Magazine Entrepreneur Spotlight Series today.
It's great to be here. Thank you.
It's great to have you here. I mean, what you're doing at Veuu is really interesting. You're really solving a big problem. But before we get started and get into it, let's have you take a moment, pull the lens back to 30,000 feet. Tell us about Veuu, and then we'll get into it.
Yeah, so we're really a scalable fintech for healthcare. We are focused on solving some of the biggest problems, maybe in fact the biggest problem in healthcare that hospitals face today. And as a business that is focused on doing that, we're also really interested in improving the quality of care as a result of providing a solution that hospitals can benefit from.
Yeah, I love it. So let's talk about it because, you know, hospitals, a lot of people don't think about it. I mean, they're really running a business. I mean, they have healthcare administrators and they have executive teams. And yes, they're so passionate about solving problems for their patients, but they also have a business that they have to run. So let's talk about that. What's the big problem that the hospitals reach out to Veuu about, and how are you solving those problems?
Well, the biggest problem is about collecting on bills and getting paid. And because you're running a business, you want to get paid. But there is a lot of things that go into hospitals actually getting paid. You have to submit claims on a timely basis. You have to know how to code the claims, and you have to know what the risky claims are versus the non-risky claims. And all of that costs a lot of money. So if you can't code them right, it leads to larger claims denials that lead to days in AR just being extended out, be essentially to something that people can't really deal with. But somehow they manage to. But it always seems that their hospitals in the US are on the verge of not being there. And that's the scary thing. And we have to help them. And so that's what we're focused in on.
Yeah, that makes so much sense. Of course, these account receivables or the AR in the hospitals are a big problem. And you're stepping in to sort of solve that through your coding technology, of course, making sure that the actual claims are all coded correctly, because that increases the speed at which the hospitals get paid. But let's pull the lens back a little bit further. For the people watching the show, you know, people like me, you know, we don't really understand the insides of what's happening at the hospitals. Let's pull it back a little bit further and let's get a little bit more simplified. Let's talk to the entrepreneurs watching the show. You know, they go to the hospital, they think, you know, their insurance pays it and everything's, you know, copacetic and everything's done, but it's not really the case, is it?
It's not the case, because there goes so much goes into, as I said, actually getting anything that you go to the hospital to have done serviced, number one. And then number two, the ability to actually have the hospital create a bill and do it in a timely manner, and then to send it out to insurance, whether it's government-related insurance like Medicare, Medicaid, which we call CMS, or whether or not it's private insurance like United Healthcare and some of the other big names that you hear about all the time. And because there's so much that goes into it, today, healthcare is really about people. And it always has been about people. People make the wheels go round in the hospital. But there comes a time when there's a lot of administration. And in order to get a bill out, may be otherwise automated, abbreviated, and in some ways out the door on a regular basis where there is no catch up by the hospital necessary, that they're always up to date and they can get paid as a result right away. And we are interested in one big thing, and that's adjudication at discharge. If we can code a claim and we know the risk associated with it, then we're perfectly happy to start paying the hospital ourselves and then get adjudicated on the other side.
Wow, that's so powerful. And of course, you mentioned something a little bit scary. I mean, here we are, Terence, we're talking about it. And you said, hey, some of these hospitals, if they don't get paid correctly or fast, or in an accelerated fashion, I mean, how do they run their business? Are we at the, precipice of maybe some hospitals not making it right now?
Well, you see a lot of roll-ups in the industry. That's what everyone hears about, is hospital roll-up after hospital roll-up. There are businesses that do it very, very well and run a tight ship. I think everyone's goal is the same: improve the quality of care, but do it in a fiscally responsible manner. But when you have to wait to get paid on average of 73 days, it makes it extremely difficult to do that. And so therefore, those are some of the big challenges. I think that there are a lot of hospitals that need cash. There's no doubt about that. But at the same time, you have to run a fiscally responsible business, like you talked about early on in the discussion, because without doing that, you're not going to be around. Having too much overhead, you're not going to be around. All these things that we know as a business owner, you have to practice. And it just seems as though that there may be some shortfalls in the industry that need to be fixed. And the largest one is the one that we're talking about. You've got to get the bills paid. There's no doubt about it.
Yeah, I love it. It's so interesting. And, it's going to be so helpful and such an amazing opportunity for the healthcare providers and hospitals to work with you. Of course, I want to talk a little bit about security. But before we do, when I look at it, I sort of think of this as a premium workflow opportunity. I mean, workflow is so important for all businesses and especially for hospitals. And it looks like you really accelerate and automate a healthcare system or a healthcare company or a hospital's existing workflow. Is that what we're really talking about here?
Yeah, hospitals, for the most part, work on workflow with EMR companies. They can be small EMR companies, but there's two very large ones, Epic and Cerner. We are integrated into Epic and Cerner. And what does that mean exactly? So as technology goes, we've built an entire ecosystem around the workflow of coding a claim, getting it risk profiled, and then getting it paid at adjudication. And a lot of people don't know even what that means. Either you haven't been to the hospital, or because, and that's a good thing, or because you just don't know, because everything that goes into making this happen. So adjudication at discharge is what we call the holy grail in healthcare, the ability that when you get discharged from the hospital, whether you're an inpatient, an outpatient, any type of ambulatory or what we call emergency room care, you leave, the hospital is paid, your patient responsibility is paid by you. You don't get a bill 90 days later and say, oh, what's this? And it's an outrageous sum of money that you didn't expect. That's all what this is about. And by integrating into Epic and Cerner, we find that since they're controlling a large portion of the US healthcare space in terms of EMRs, that we can engage in a customer success benefit with them and walk into their customers with them to provide value in the process. So we know that if we provide value, for instance, automating the entire coding exercise by doing it in an autonomous way, automatically, that a human won't even see a claim unless we can't handle it for some reason. And all of that is done in seconds. So the ability to say, you don't change your workflow, you do everything you do in Cerner today, but you're really training your staff to know two things. Now you're never going to see a claim unless it can't be handled. So that's interesting in of itself. And they can become data-driven type employees in the actual organization so that they can start having insight into improving the quality of care based on the insights that we're giving them back. Because this is all about, look, it's all about data, data, data. We want to share that data back so that they can make better decisions. This is about moving people around, not getting rid of jobs. And that's what everyone gets concerned about when they hear AI. But this is turning humans into superhumans and the ability to have them really address other tasks that are probably a whole lot more important to the hospital.
Wow, I love it. Turning humans into superhumans. I'm going to steal that one from you. I love that, Terence. Now, let's talk about it a little bit because you've got this system. Now, I want to understand this a little bit more because it's pretty interesting. So once your system adjudicates the claim and Veeu's program says, yeah, this is a claim that is going to be paid. I mean, this is, a no-brainer. Does Veuu step in and pay the hospital and then Veuu goes out and grabs the claim, or the hospital gets the claim directly from the insurance carrier without Veuu in the middle?
Well, when a bill is actually created in the hospital, that's actually called a claim, an insurance claim. And the insurance claim gets sent out through a clearinghouse to the insurer. And we refer to them as the payer. Pretty simple to understand. And then the payer is adjudicating the claim, meaning paying the claim or saying, I've got an issue with this claim, or denying the claim, or whatever they do with the claim, they are the ones that are paying the hospital. Today, the difference will be the following. As I said, we'll code the claims in your workflow. Even if we think that it's a risky claim in the end, we are going to pay the hospital. And we're going to pay the hospital on what we call negotiated rate. The same rate that they have with that insurance company for that service, we're going to pay them based on that amount. And then, yes, we're going to get adjudicated by the insurer directly. Now, we're starting with private insurance claims because handling government claims is really a little bit different. And there's a little bit more process and compliance to work through, but we'll get there. Probably in the next 6 to 8 months, we'll be there. But for the most part, you're talking about actually saving a great deal of time. So think about this. You can code a claim today. You can profile that claim in terms of risk, and you can adjudicate it and do it within a second, literally a second. Something that takes humans up to 5, 6 hours or even more to do. And then you have to wait to get paid. Today, we're talking about this real acceleration, and the timing is so important that we can actually do this on the fly and handle real scale and volume from the large part of the industry, actually. So it's pretty exciting.
Wow, it's so exciting. I mean, I can't imagine any hospital in the United States not wanting to use Veuu after hearing this story. I mean, it's really remarkable. Let's talk about it. I mean, how long did it take to build the platform? What's it built on? Because you mentioned data, data, data. It sounds like it's a very impressive platform that's been built by you and your team. And let's talk about how long it takes to build something so robust.
It's years. I mean, it's years of work. And this is not easy stuff. This is heavy lifting. This is what AI is really about. It's able to do things that humans don't do very well. Look, as humans, we do things very well, like having this conversation. An intimate conversation is easy for us to have, but we're not very good at scaling databases, picking things out of databases, trending databases. We're just not good at that at all. And nor should we be, but machines are very good at it. But we didn't build it in the same way that people think that, or it might be built. I mean, usually within the world of AI, what happens here is you would think if you want to build an automatic coding device, you would train the AI based on claims data. But what we found out very early on in the process is that you would never see enough claims to actually train your AI. And what we really found was that that wasn't the problem at all, that it was a language problem. And very simply put, every doctor speaks differently. If you ask a doctor to diagnose patient A, they might say it in 3 words. And if you ask another doctor to diagnose the same patient A, you know what? It could be 25 words buried in a paragraph. That's what makes this difficult. And we found that if we could train our AI based on healthcare language and be able to read the entire EMR record, which is your patient record while you're at the hospital, that was what was really needed and required to execute this accurately, reliably, and at speed and scale. And if you could do that exceedingly well, and nothing that I'm describing here is easy or for the faint of heart, I should say, is that there's a lot of hard work and AI that goes into it to the tune of running multiple models at the same time. You know, most AI, they do some of that, but not running what could be as many as 25 models at the same time, so that they all work concurrently with one another, or running such frameworks and libraries in a secure environment at AWS, which is Amazon Web Services, so that they perform well and it's secure. And you don't have an issue with cybersecurity or things that we really care a lot about, like HIPAA compliance, or what we call personal health information. We're all very interested in the protection of that data. And so therefore, you have to do all of this in such a way that you're complying across the board, but yet you're executing for the customer. All of these things are vital to making this successful. And the AI has to work in a particular way. And the science is what pointed us early on that this was language, that this wasn't actually about data in terms of the data inputs. The outputs are very data driven.
Wow, so interesting. I'm so happy you talked about HIPAA and, of course, compliance and, you know, all the security measures, you know, when a company uses Veuu. Let's talk a little bit about AI. You know, I was looking forward to having you on the show. I know you're what I call a forward thinker, somewhat of a zeitgeist. You know, you think about what's happening in the future, obviously, with what's happening with Veuu. What's the AI, you know, story? I mean, everybody, you know, who's not in the technology world, and some people in the technology world, they're starting to freak out a little bit about the AI. You know, they're starting to get a little bit worried. I mean, what's your perspective of where AI goes here and, you know, in the next 10, 20 years?
Yeah, it's an interesting question because pre-COVID, we were dealing with, we still need to explain AI. And I feel like, you know, on the other side of COVID, we're still needing to explain AI. And I think that it's because it's esoteric. It's not very well understood. And, you know, early on and AI has been around actually much earlier on than I would think, but since the 70s in some respects, of course. And so it became popular here, though, you know, fairly recently in the last 5 years, it really picked up steam and it started moving. And what was interesting is all these developers jumped in to AI and started building these solutions, and then going out and looking for a problem. And that's never worked in this industry. Starting with the business problem first will lead you to what you have to build, which is the solution. And that is what AI is. It's an intelligent system of engagement that will drive a solution, and that AI is made up of all sorts of things, buzzwords that you hear. So we hear machine learning, we hear data analytics, we hear big data, we hear NLP, which is natural language processing, which I just talked about actually. And so therefore, all of those things, those are all tools of AI. So people use the word AI interchangeably with ML, which is machine learning, as an example. Well, machine learning is a tool of AI. So it shouldn't be talked about in a separate way. It's the same. It's just a tool of AI. And so therefore, I think knowing really definitively what this is important. And then for the past 5 years, everyone's been worrying, well, AI is going to take over the world. Well, I have news for you. Robots are not taking over the world. Robots are dumb tin cans, and they seem to have faded by the wayside as quickly as they arrived on scene. They do what we tell them to do. They don't think on their own. And there are some technologies in AI that are trying to get there, to get to the next level of AI so that robots could conceivably think on their own. But we are way off from that happening at this point. But what people are really worried about is, will I still have a job? So in the case of healthcare, people might get very concerned about this AI that we're talking about on this show right now is going to replace people's jobs. And we didn't say that, did we? We said that this AI will work to make humans better at what they're doing, and in fact, direct them into a far better area within the hospital where they can do things that are more meaningful tasks than the stuff that they're doing now, which perhaps as coding goes, can be done by a machine. But I don't think it works without the humans. We learn from the humans in AI. And that's what's so apparent to me and needs to be apparent to other people. This is not humans versus machines. It's humans that work with machines. And that is what makes this successful. It's interesting. So I don't think people should be as worried as they may be about robots taking over the world and about losing their jobs. And when you actually, one important point, go back and look at in the past 5 years, how many jobs AI has actually displaced. It's not the case that these solutions may go in and actually people get retrained in order to actually service the AI and work with the machines and then become data-driven, sharing insights that the AI has. It's very interesting what's happening. So the numbers don't prove it either. We're seeing a much, much different landscape. And I think we can all benefit from it. And healthcare can really benefit from it.
Wow, Terence, what a clear-sighted sort of viewpoint of what's happening. You made it so simple. You took a very complex issue and simplified it for the viewers. I really appreciate that very much. And of course, you only cut out a certain amount of time today. I know you're doing some traveling, so we need to sort of, I don't want to take too much of your time because I know you're running Veuu and you're doing so many good things. But here, I want to talk about entrepreneurship because that's so important. Obviously, you've built a great team at Veuu. I mean, I know you're a big believer in surrounding yourself with the best talent in the world. And you yourself, of course, do so much good and you help others and you mentor others. I know you've had some mentors along the way in your life as well that have been remarkable. Let's talk to the younger entrepreneurs because we have some younger ones watching the show. Maybe they're older, but they're in a startup and maybe they're hitting a roadblock. Maybe they're hitting a pothole in the road. Maybe they freeze in the frame. They don't know what to do. Maybe you can share some insight based on your experience and your journey to the other entrepreneurs about what it takes to get through a tough time in the entrepreneurial journey.
Well, we've all heard the saying, or if we're all entrepreneurs, we've heard the saying that if it was easy, everyone would do it. It's not easy. We take risks. And part of taking risks every day is to know that if the risk works out, the reward is there. And part of that is really about attitude. What is your attitude on a daily basis towards the risk that you're taking? So if you're taking all of this risk in the back of your mind, whenever you're doing anything, you're thinking about this risk. Maybe you're not sleeping very well. Maybe you go out with friends and all you're thinking about is work, 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 work. And you're not focusing on a real work-life balance or the things that people say you should be doing. You're not sleeping well. You're not working out. You're not doing all of these things. And if you're young and your mind is young, it's important for your mind to stay extraordinarily sharp as well. And if all you do is your risk, then you know what? You're not staying sharp and you're not doing the things that you need to do in order to stay healthy. Because it involves travel, and it involves travel during COVID, and it involves going into an airport and getting on an airplane and doing all these things that people are in themselves concerned about doing now. Though I should tell you, in traveling, a lot of people are traveling, which is great to see, is that this risk is not all you're about. Your mind has to stay clear and stay focused. And that means as human beings, we do a lot more than just the risk that we do every single day in our work. And that know that if you apply yourself properly and you apply yourself well, and every day you get up and you're excited about the work and you're focused and you're sharp on what you're doing because you have that work-life balance, you find that things start to come and things start to work. And you know what? Not everything works. Sometimes it doesn't. And it is not about getting hit and how many times you get back up. It's about taking something away from every single thing that you do. And if it doesn't work, why didn't it work? What happened there? And let's not do that again, or let's turn it around and try and make it work better next time, or try and make it work better now. There's nothing that says that you can't try and try again. And so I think that that is all about what I have chalked this up to being. The other thing that you have to do as an entrepreneur is you have to really study the managers that have done this well. We're never done becoming a better manager. For the people that work for us, to even ourselves and everything that we do in life. But being an entrepreneur means that people don't have to work for you. They have to want to work for you. And that's what's really meaningful. How do you treat people around you? Are they excited about coming into work like you are? Do you treat them well? And do you give them what they need in order to grow? Do you give them the tools they need? Or is everyone just so focused on risk that everyone is just freaked out to the extent where it's go, 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 go every day, and then you forget about the more meaningful things that are in life? I had some very, very good managers when I was young. And that really, really helped me to become a good manager. I would say I'm a good one. I would say that people enjoy working for me, but I'm not as good as I could be. And every day I'm trying to figure that out. Entrepreneurialism, that's what this is about. That's what we have to do. And it's not easy. If it was easy, everyone would do it. But don't focus just on that. You have a life to lead. This is important stuff.
Terence, that's remarkable. I mean, for the people watching the show, the younger entrepreneurs, if you're thinking about going to Stanford or to Harvard to take some management classes, just skip it. Just rewind Terence's, last 5 minutes and you're going to get a full class right there. I mean, that was really awesome. Listen, I'm going to bring you back on the show. There's so much to unpack. I loved having you, Terence. I mean, what you're doing obviously at Veuu is super important and super interesting and really solving a huge problem, for the healthcare providers being in the fintech space and using all of this important process that you put together over years to make it just a seamless sort of workflow for your customers. I really wanted to thank you so much for coming on the show today, Terence. This has been absolutely fantastic.
It's really great to be here. And thank you so much for your time and your audience's time. And I look forward to the next time we chat.